We are back with social infrastructure, that is health. And what are the suggestions to improve the effectiveness of healthcare? That's basically what we have to say. Healthcare programs. The most important thing is implementation. The programs per se are very good. They come up with very good plans. Even if you see a new government hospital coming up or a center, it's so good. It's in the prime place, etc. But if the maintenance is not there, the implementation part has to be there. So only then can we get a sound health infrastructure. The primary health centers should be looked after well. We should reduce the gap between the urban and rural healthcare, because otherwise they keep running to the urban areas, and by the time they reach there, they have no place to stay and all that. So, and the most important thing is accessibility and affordability of the basic health care to all. So instead of all those grandiose plans, it is very important to see that there is what is there? Accessibility and affordability of basic health care to everyone, one and all Indian. So that is the basic thing that we are going to talk about. So what are the suggestions to improve the effectiveness of health care programs? So health is a vital public good and a basic human right. So all citizens should get better facilities, and this can be done if the public health services are decentralized. So they should be spread all over. Then there has to be a very good infrastructure, sound health infrastructure, which means we have to create awareness on health and hygiene and provide efficient system. And in this, the role of telecom and information technology sector, they have to play an important role. So these have to be made use of in order to bring about, or rather educate people about a sound health, a great health infrastructure. Any effectiveness of healthcare program cannot be done without primary health care. So only then can people really move towards a better quality of life. Then you have this, to reduce the gap between urban and rural healthcare. We find a divide between urban and rural healthcare in India, and we are ignoring the divide. And if we do that, it will again lead to destabilization of the socio-economic fabric of our country. So that is a risk we run. There'll be a lot of discontent. There'll be social unrest. And the most important, last but not the least, is in order to provide basic health care to all, that is accessibility, that means everyone should be able to afford and should be able to get what they need. And this should be whatever changes or whatever improvement they want to do, this is the most important, that it should be affordable by all. So these are certain suggestions, and you can add some suggestions, but just remember the points should be there. Don't just keep weaving stories along the point. This is what I've just done through the books that are prescribed.